Migration is a defining feature of the 21st century. Over 250 million of us today were not born in the country where we live. Yet, when we migrated, we did not leave our human right to health behind. The World Health Organization runs a training school every year, which brings together governments and experts from around the world to discuss the needs and rights of migrants and refugees. Our global health and well-being is tied to their individual stories.
I'm Dr. Ahmed Musallati. I'm originally from Syria. I make my residency in Razi Specialist Hospital. I watch a lot of wounded people suffering from burns, like chemical gases. I have post-traumatic syndrome after that because I watch a lot of dead people. I got depression. So I leave my country for a better future, for a clear future.
The World Health Organization's School on Refugee and Migrant Health is a forum where countries in and beyond Europe can benefit from each other's experiences to improve and adapt their healthcare systems to include international migrants.
For a long time, the health issues were considered almost a side effect of the migration process, of the refugees process, which is not. In reality, we move towards a public health approach. We move towards an issue of inclusion from the public health point of view because the size of population doesn't allow us to turn the face in the other side, because to have 10% of the population in our region neglected from access to service will be indeed a major concern.
First response solutions are still crucial. But one of the key messages from the school is that countries should also focus on long-term health planning for migrants and refugees. Health policies should fight discrimination, embrace diversity and improve social cohesion.
When migrants are seen in the healthcare system, a lot of times they're really chronically ill or acutely ill. And so the burden on the healthcare system might be greater than if they were engaged in preventative healthcare. So I think this focus on migrant health is really important, to recognize that migrants, yes, are human beings, but when they come from a different culture than the host country, and it doesn't matter what the host country is, their utilization of services might be different.
Migrants, refugees are always from the process of being to becoming.
We need to do something more to work against discrimination and xenophobia.
It's not as if everybody in Europe is on the same page when it comes to tackling inequalities or when it comes to migrant health. Oh, it's such a complex issue, and they sort of throw up their hands and say we can't deal it. Yes, it is complex, but we can do some if we can't do all when it comes to migrant health.
We all have to see the links between the social determinants, between health inequalities, between other initiatives that are happening.
Probably there is an issue of communication, public communications.
Participants at the school take part in workshops facilitated by professionals with first-hand experience working in specialist areas of migration and health. These workshops build networks among experts and policy makers.
I learned a lot. I got a new perspective, like WHO perspective, NGOs, and even immigrants' perspective.
I think it's been very useful to me because as a medical doctor doing research, I think I need to think really careful about asking the right questions to make my research relevant. So it's supported me to stay with my patients every now and then to know what they think about. But also, like here in the summer school, I met NGOs, Ministries of Health, the WHO, and really to see what they work with, what they are concerned with, would make me ask more relevant questions.
The school encourages countries to bring about policy changes which can improve health outcomes for millions of refugees and migrants in the European region and worldwide.
My presentation is about the issue of improving the integration of migrants and refugees' health into mainstream health systems.
What made me feel proud is that we initiated something new. It's a piece of innovation, a work of the WHO European office. There are not other schools of this type within WHO, so we are playing a dual role, not only reaching member states, countries, academicians, experts, but also we are building a culture into the organization. It is essential in order to position as a WHO in regards to actions towards migrant and refugees' health agenda worldwide and regionally.
Taban avval meci ilk geldiğimde hocam 2014'te Konya'ya gittim. Konya şehrinde ben bu sağlıkta çalışamıyorum çünkü Suriye'de mezunum. Orada bir havalandırma firmasında çalıştım. Ondan sonra bu eğitim oldu. Bu işe katıldık. Çalışabildim yani. O da işte içten sevinçtiriyor yani. Yani dışarıdan belli etmez ama içten farklı bir şey yani.
Our future is a global future. Universal health coverage is a global ambition. The World Health Organization is working for refugees and migrants because our health depends upon it. Let's focus on a healthy future together.